Yes. We know that there's people on the waiting list who are waiting to come in for transplants now who probably have a better chance of surviving the procedure.
Yes, yeah, amazing.
Everybody knows me at the doctor. It's like, oh, right, Nicola. And it's really bugging because I hate going to the doctors. I don't like hospitals either. Bit of a shame, really.
Okay. Make the transplant coordinator and choose.
Nicola Hill has had a week of tests at the Children's Hospital. Her condition is deteriorating more quickly than the doctors first thought. The team must now spell out to Nicola the severity of her situation.
This is a tense and difficult time for you and for your family.
Your oxygen's low, we give you oxygen, but that's not doing anything about what's underlying it.
I get the feeling that it's limiting you rather more than it did last year. Well, that's only in, what, 3 months or so since we've seen you. So for you, it seems to be progressing quite quickly.
I think the best treatment for sure for you is liver transplantation. Okay, no worries or fears about saying that at all.
The downside of that is complex.
Nicola's transplant is now more urgent, but the risks are high.
We spoke about survival rates. I was talking about 90% at 1 year. Would you see that as?
The fact that it is autoimmune hepatitis and that you have got a low oxygen level. So there are things that, no matter how you do increase the risk. But I think it'll be taking it down a little, maybe to somewhere in the range of 80 to 90%.
We expect, the quality of life after transplantation is good.
For Nicola, a transplant now carries a 1 in 5 chance of her dying.
It's a bit like,
and you can't have life.
a lot to take in, and sometimes you're a bit confused by what he's saying in that, and it's weird that he's telling me this stuff.
We may have to ask questions about whether it's...
I think I want to have it, because to help me get better, but it's just hard.
As part of the consent process, 14-year-old Nicola agrees to the operation and the risks involved.
Very frightening, the thought of a transplant, and I've got lots of ideas in my head about transplants in the past, and how they can go wrong, the rejection and all that sort of that you think of. So it is frightening.
Her clotting and platelets are normal.
Before Nicola is put on the transplant list, the team must agree on her level of priority.
Right, thank you very much, Sue. Thank you for joining us. If we just go back to the main transplant meeting now, so could we start on the top then, start with Nicola? So there are a number of issues we need to get sorted for Nicola before she's listed.
The transplant list is split into different blood groups. Anyone with the same blood group is in competition for the next available liver. The medical team have to rank patients in order of priority.
The commonest blood group, which is blood group O, you often have to wait quite a long time because although it's a common blood group, there are a lot of people in that category. The best blood group to have is blood group A, because although it's not the most frequent one, then there aren't too many competitors on the list.
Nicola is blood group A. She is in direct competition with 3 other children on the list.
I've to recommend this.
One of these is 4-year-old Lauren Pluckrose. With such a scarcity of donor livers, Professor Kelly must try and predict how long each child can survive without a new liver.
Oh, do you think we should tell her what we're going to do first? Daisy, we're going to give you some medicine to help.
In Lauren's case, the prognosis is poor.
She doesn't want it.
The liver, in fact, has deteriorated quite rapidly, and she's developed a number of complications. She's had a lot of fluid in her tummy. She's bled from her stomach. And she's developing this the lung complications.
It's okay, we're just going to put a sticker on. Listen to Lauren. What does it say?
And if she's not transplantable, what will happen in the next year or so?
Well, she'll slowly die. I mean, she's slowly dying. She's being kept by medical management.
The team must choose if Nicola or Lauren should be the first in line.
I think the girl will have...
But I have a priority. Nicola's blood group is A. Lauren's. But will they be competing with each other?
Yes.
So will we put...
Yeah,
but should we give Nicola first? Right, so if we put Nicola on as priority and Lauren on as urgent with the proviso that we...
After assessing both children, the team have decided that Nicola's lungs are deteriorating so fast that she must be transplanted as a priority. For the time being, Lauren will have to wait.
It could be days rather than... I think they're saying the average is between 50 and 70 days, so certainly not going to be much more than a month or so.
Just want it over and done with, so I can get back to normal.
What I can say to you, Kerry, is I have been sober since the 24th of April 2002.
Okay.
If Wayne Resnick is to get on the list, he must convince psychiatric nurse Kerry Webb that he has stopped drinking.
Nothing since then, not a lager shandy, not a glass of wine.
Not a sip.
Nothing. And so...
Kerry must explore every aspect of a patient's character before recommending them for a precious liver.
When did you start smoking the hashish?
15 years ago.
Do you smoke every day? Do you smoke a joint every day? Okay. What about other drugs?
Yeah, I've snorted cocaine.
You've snorted cocaine. How long ago would that have been when you last snorted cocaine?
This morning. Years ago. I couldn't help it, sorry. Years ago.
What about heroin, for instance?
No. Ecstasy.
No ecstasy?
Yes.
You have ecstasy. Again, years ago?
I was part of the original rave culture.
If things do go...
Kerry is concerned about Wayne's ability to lead a responsible life.
What qualifies you to sit here and talk to me?
My background is I'm a psychiatric nurse who's worked in alcohol and drug services for...
While the psychiatric team come to their conclusions, Wayne is sent for more tests. Wayne's alcoholic liver disease has caused internal bleeding. The doctors need to assess how serious the problem is.
So if you open wide...
The team must now combine Wayne's psychiatric and medical information to decide if he should be put on the list.
Okay, Mr. Resnick, we'll get you back up to the ward now. I'll catch up with you tomorrow morning.
Okay.
Okay?
We'll talk about things further tomorrow morning.
All right?
Yeah.
Bye for now.
Well done, Wayne.
Okay.
Nicola Hill has now been waiting for a liver for 2 weeks.
All we do now is listening for the phone call, because that's the next step. It's just waiting for the phone call and crossing your fingers, or sometimes going, oh no, is that it?
We get really worried if she's late or anything, in case she's like gone down to Birmingham.
Do you all get nervous when the phone rings now in school?
If it did, we'd probably wet ourselves.
How can it be more?
No one knows how long her wait on the list will be. Somewhere in the UK, someone will have to die to give her the chance of life.
I try to just put it back in my mind and don't worry about it, because that'll just make me upset all the time or worse, or I just got to get through it.
We wear short skirts now.
This has been working, it's been good.
What do you like most?
I like most watching you playing football, being with the family when things are going well, travelling with the family.
When this happened, it was on the edge of him coming up to a very good spell, and he had been so well for the last month or so.
Yeah, but
this is almost incomprehensible.
The doctors have gathered all the information they can about Simon Vickers. They've talked to his GP, psychiatrist, and family.
just think the line blurs with mental disease. I think that is because it is a biological disease, and therefore it is not his fault as such for him to have taken the overdose. It's the disease working on him.
The moment has come for the team to decide if Simon Vickers should be listed for a transplant.
The only question is that because of his psychiatric morbidity that he wouldn't cope with a transplant.
I mean, if he expressed, misgivings or remorse at an early stage, I think that would help seal it, really.
He's with a very supportive GP, he's with a very supportive psychiatrist.
Yes.
So
he continued to have plans with his wife following the overdose. Maybe he didn't appreciate the significance.
He is a valuable sort of person in society if he's very competent and had a good job in Hong Kong, a caring job, a job concerned with people. He knows a lot about government and all sorts of things which would make him an objectively valuable person.
So should we list him?
Yeah, I think that's the right thing for him.
Okay.
Simon Vickers' name will now go on the transplant list.
Well, we're going to list him.
He's in it.
I mean, I wouldn't like to say it's my decision. It's a joint decision. It's something that we make as a consensus. It's not my decision any more than it's anybody else's individually. Yeah, of course, if we had more livers, it'd be easier.
Moira Perrin has responsibility for coordinating the operation. Her job is to locate a donor liver as quickly as possible.
I'm just registering as super urgent. I've sent the fax down, so hopefully it's coming through to you. We registered this patient for liver. We need liver very quickly for this gentleman. And if there's any livers that become available, they'll be offered to us.
Super urgent is the top level of priority. Not only does Simon Vickers jump to the top of the Birmingham list, he is also put to the top of every transplant list in the country, taking priority over all other patients.
Sometimes you can be very lucky at the time you're registering a patient that a liver donor is being registered at the same time. Sometimes you wait a couple of days. Sometimes you never get the liver in time.
Simon Vickers is blood group O. Every person in the UK who needs a blood group O liver will now have to wait. Nicola is in a different blood group from Simon Vickers. Blood group A.
It's about 4 weeks that she's been on the list. Well, I feel that it's dragged. It's been a long, I feel that it's been a long time waiting. Not looking forward to it, of course. Not looking forward to it at all.
I think today is decision day. And as Dr. Thorburn's on his rounds right now, I imagine I'm going to learn something of what they've learned today.
This man will die without his transplant. And he has no time to wait. We could say to the people on the waiting list, you have a little bit more time.
If the phone goes at night, late at night, and you think, oh, people don't normally phone, this late, or it might be the hospital. Hello. Hiya, Kathy. I'm all right, thank you. Yeah.